I'm Harshada Rajadhyaksha and I've been a physical therapist for the last 26 years. I love adventure sports, I love trekking, I trek every year. For the last 4 years I've been going to Nepal. I trek high up in the Himalayas, I love the Himalayas. 2015, in the last year, I was trekking on a really lovely path, about 14,000 feet altitude, with a really dear friend. And the earth just shook beneath our feet. It was the terrible 2015 Nepal earthquake. I was involved in a huge rock landslide, a huge amount of rocks, big rocks were thrown at us. I lost my dear friend and I was very badly injured. I had to fight for my life. I was lying injured on the mountainside for more than 20 hours before the helicopter came to pick me up. But I was calm and cool. I had no fears at that time. But in the last 18 months, a lot of fears have crept in. And the biggest fear has been, because I've been such an outdoor person, the biggest fear has been of when and how I would get back to all the activities that I wanted to do. But because I've been a physical therapist, I knew what path I should take and how I'll recover and how much time it will take, what I need to do to get there. But this injury actually forced me to look at my profession from the other side. I realized that my patients who do not know what's going to happen to them, this fear they are not able to handle. This is the fear that I need to address. We at Prakriti recognize this individuality in everybody, and we form individual programs which include treatment as well as exercise. We deal with the injury management really well. The initial part of the injury is dealt with really well and very professionally. But after the initial part of the injury is done, that is the place where there is a huge gap in what the patients need and what the doctors actually do. This I realized very early on in my career. And I thought, what if I learned everything that there is to learn about exercise and its adjuvants, so that I can help my patients after their initial injury, right up to the time that they get back to doing what they really want to do. The last 18 months have been a big struggle physically for me. Each day has been a challenge, getting back to work, getting back to just walking with crutches, walking with a walker, and slowly evolving into everything, getting back to what I want to do has been a big struggle. When I got scared or when I had these fears, I knew the answers, so I could deal with my fears. But I recognize these fears in my patients. I deal with their fears first. And once their fears are dealt with, then the trust that forms between me and them, that forms the basis of all further healing. The one thing that I have learned in the last 26 years of practice is that when you challenge your fear and you turn it inside out, your whole perspective changes.